Welcome to our In Focus discussion tonight on societal inequalities in COVID outcomes. Communities of color make up about a quarter of Utah's population, but they represent a third of COVID-19 cases. A similar trend is being seen across the country as well. Why are racial minorities unequally affected by the COVID-19 pandemic, and what can we do to reduce the problem? Joining us tonight are Dr. Daniel Mendoza, Assistant Professor for the Department of Atmospheric Sciences, and Dr. Tabitha Benny, Associate Professor for the Department of Political Science, both from the University of Utah. Thank you so much for being here tonight for this conversation, and welcome to the show.
Thank you.
Thank you.
Tabitha, we'll start with you. It's been more than a year and a half since the beginning of the COVID-19 pandemic in Utah. What do we know so far about how the virus has impacted our population based on demographics? Do all groups have similar COVID-19 incidence rates?
Thank you. That's a great question, Rosie. I think it's important for us to highlight the important impact that certain communities have had versus others. In fact, our low-income communities in particular have been impacted by COVID-19 from early on. And research has supported this idea that minority populations in particular have been hit hard by COVID-19, and we've seen that here locally as well, as you've noted.
Now, Daniel, can you tell us about the study that you two are working on and what prompted your research?
Yes, during the first part of the pandemic, the University of Utah put substantial interest and resources to really try to identify what are the issues in terms of the pandemic, in terms of the outcomes. So, of course, there is the medical side, the biological side, trying to really understand the virus and ways to prevent it. But then our idea was really to look at the actual impact on people and on society. And so thank you to the 3I Initiative. They were very supportive of our work, and they funded our grant that helped us really identify what are the differences between social demographic groups in terms of their contagion rates. So that's really what we wanted to look at in a more societal and behavioral way.
Thank you. Tabitha, anything you want to add to that as far as what prompted the research?
Yeah, you know, we were a group of interdisciplinary researchers over at the U. Many of us hadn't worked together previously, and so it was an interesting idea. We were really just beginning to understand the pandemic and what was occurring at that time, and really beginning to learn about how to interact with each other in these fields to accomplish something in a really timely, efficient manner. We began to sort of unfold the data from our different fields, and that's really when we began to see these patterns of social inequality that were laying down over top of COVID incidence rates. And that's what encouraged our team to actually go a bit further and look at this from an inequality perspective, along with many other colleagues, as you know, in the field today.
Now, Tabitha, one term that I saw over and over again in your research is structural inequality. So can you help our viewers understand what structural inequality is and why it applies to how the COVID-19 pandemic is playing out?
You know, Rosie, this is such an important question. When we think about structural inequality, we're really talking about the institutions, the policies, and the cultural references that surround us in our everyday lives here in society. Even the media here, it tells us how we should reflect on ourselves and where we belong in society. And so it's quite important because in our daily lives, we all sort of contribute to this idea of the structures that surround us. For the majority of us, these structures are very functional and they work very well. They suit us well in our determining our future decisions in our lives. But for a small portion of the population, minority populations in particular, they tend to have a big disadvantage. And this disadvantage is reinforced through these structures. And so while it might work well for some of us, there are some people that have these intersectioning inequality problems that are quite difficult to deal with. We often think of inequality as being a single facet, but inequality is really a variety of types of inequality. And while some people might face one or two types of inequality, unfortunately some people in society face multiple types of inequality. Everything from gender, race, income, occupation, even where you're born can largely determine your outcome over time in life. This is consequential because we largely think of inequality as something that happens over time, throughout the generations, or throughout a person's lifetime. But what we saw was COVID-19 made structural inequality quite apparent rapidly. And this is why we find structural inequality to be such an interesting or persuasive way to look at this problem of COVID-19.
I think you bring up a great point, and also that sometimes when people think about inequality, they think about race and ethnicity, but like you said, it applies to all sorts of demographics, and there's intersectionalities with people who fall into multiple categories. Daniel, why did Salt Lake County make an ideal site for exploring the link between inequality and COVID-19 infection?
Well, Salt Lake County is a really great place to study for many aspects. Although we didn't specifically focus, for example, on air quality, which is in an upcoming study, we have the world's densest and most reliable air quality monitoring network. We have a significant amount of data here, and we have really great relationships with the entities such as Salt Lake County Health Department, which provided a large amount of the social demographic, as well as the COVID-19 incidence rates, which were crucial to our study. So what we were able to do was to really drill down and get some very granular data, which is critical for these kind of studies. What makes our study unique is that we're looking at this at a zip code level, which is really the smallest kind of unit where we can get reliable social demographic data, which includes race, income, as well as occupation, because while race and income tend to be the most focused areas, we really wanted to take a look at occupation, primarily because of that new concept that really just evolved, which is essential workers. For us, when we started to really look at the data and see the astounding differences in terms of contagion rates, we realized that, unfortunately, these workers are considered expendable by the economy. And that's why we really wanted to highlight what happens when you're a frontline worker, what happens when you're there at work all the time, because for many of us, we're fortunate enough to be able to work from home, but we need to really understand the plight of the most vulnerable members of our society.
Right, and I think we came to a lot of that realizations during the pandemic. Daniel and Tabitha, hold that thought. We have to take a quick commercial break, but when we return, we'll resume our In Focus discussion on societal inequalities and COVID outcomes. Thanks for staying with us for our second In Focus discussion tonight on societal inequalities and COVID outcomes. We resume our conversation with Dr. Daniel Mendoza, Assistant Professor for the Department of Atmospheric Sciences, and Dr. Tabitha Benny, Associate Professor for the Department of Political Science, both from the University of Utah. Tabitha, let's get into the findings of your research now. When it came to stay-at-home orders, which population showed the best response to the lockdowns?
Yeah, this is a really important finding of our research. When we first began to look at mobility to try and understand how the stay-at-home order here in Utah functioned, we found that the most affluent communities, which here in Utah are the most white communities, the most white collar, and also the highest income communities, we saw a dramatic drop, about 50% drop in mobility when the stay-at-home order was at its peak. In contrast, the least affluent communities here in Utah, in Salt Lake City, we saw about a 15% drop, and that was quite dramatic to see that big of a difference in similar time periods across the policy impact. And remembering that these are voluntary stay-at-home orders, it really showed the difference in the ability of individuals from more affluent communities to stay at home.
Right, those who could afford to stay home and those who couldn't afford to stay home because they had to work. Now, Daniel, another factor you both mentioned multiple times in your study is traffic volume. Can you share the patterns that you saw with that? Which areas saw more traffic during their lockdown periods?
Yes, Rosie. So following up on what Tabitha just mentioned, we did see significant drops in traffic from the more affluent communities, and that really follows what we think was that people were able to stay at home and work from home, or simply choose not to work if they had the choice. Whereas lower income communities, and we saw that in a direct relationship with the amount of blue collar workers, they had to go to work. So those traffic drops of about 5 to 15% in the lower income communities really told us that these people were going to work. These people had to be at their places of employment. And because of that, we can actually really think about the patterns of mobility and really the patterns of contagion. When we look at the types of occupation, when we think typically of a white collar worker, say in an office building, such as, for example, your station, everyone knows each other, everyone cares about each other. You may have gone out socially, you may know each other's kids, so the odds are that you will actually put a mask on, do some physical distancing, and really take care of each other. Whereas the occupations that are, for example, I always bring up the example of someone who is working at a cash register at a supermarket. Those members of society generally have to interact with many more people, some of who the customers may be refusing to wear protective equipment, may tend to yell, may get upset, and it's a transactional kind of interaction with other people. So therefore, they are at higher risk. So if you have to go to a job that not only forces you to interact with more people, but people who may not be caring about your health as much as some of the white-collar jobs, then that's when we really see this impacts exacerbate.
That's a great example to put things into perspective. Now, stay here with me. What did you find when it came to the predictive indicators of COVID-19 outcomes, such as what factors could we look at that could give us a good idea of how someone would be impacted by the pandemic?
Well, again, the three direct factors that we looked at were income, race, and occupation. Income and occupation really follow hand in hand. This really would make sense intuitively. Race was quite interesting, and part of it is really one of the difficulties of studying Utah in particular is that there's a substantially smaller amount of minority population members. However, several of them were actually in, for example, technology or working at the University of Utah, and for example, other places such as Intermountain Health. So some of those members were actually able to stay at home, and therefore the numbers don't correlate as well. However, income and occupation are really good indicators of being able to protect oneself and really protect one's families. That's something that we've also wanted to stress as well, is that if you come from a lower socioeconomic background, it is possible and it is highly likely that you live in a multi-generational home and that there are more people living in your house. So we have all heard stories of members who were able to quarantine themselves at home, who were able to just be in one room by themselves and really not interact with their family, and their family would stay safe and not have any contagion worries. However, if we have many people, for example, living in one room and really in a home, then that really increases the chance of everyone being infected.
Now, Tabitha, how well would you say the stay safe, stay home directive worked in protecting vulnerable groups to COVID-19?
You know, undoubtedly, many lives were saved regardless of these policies. Many more people could have lost their lives or contracted COVID-19. However, the policy, because of its probably voluntary orientation and simply because of our lack of information to some extent, many people were probably exposed in ways that the policy had little control over. That said, we do know that with those reductions, the 50% reduction in the largest and the most affluent parts of the community and that 5 to 10% reduction in the lower end, we saw a huge difference in the contraction of COVID-19 in those two communities, up to 10 times more contraction of COVID-19 in that lower end, least affluent parts of our community. So if we think about it from that perspective, we could say that those parts of the community, the lowest income or least affluent members of our community, were probably not well protected by that voluntary stay-at-home order.
All right, it's time for another commercial break. Daniel and Tabitha, stay with us. We'll be right back. Welcome to our third and final In Focus discussion tonight on societal inequalities in COVID outcomes. Before the break, we were joined by Dr. Daniel Mendoza, Assistant Professor for the Department of Atmospheric Sciences, and Dr. Tabitha Benny, Associate Professor for the Department of Political Science, both from the University of Utah. Daniel, now that we've discussed the findings in your study, what are some of the solutions we could work towards to better protect the vulnerable in our community?
Well, unfortunately, Rosie, what we experienced last year may have just been a warning shot. As we know, we are facing, for example, the rise of the Delta variant, and we really are seeing that we're almost repeating some of the mistakes of last year. All we need to do is look at some of our southern states that are really facing some huge problems. And what we really want to do is to really take everything we learned about, particularly in the impact to our most vulnerable community members. And we have all heard the horror stories, for example, of some employers refusing to provide adequate protective equipment for their essential workers. And I think among these things, we need to understand that we have to work together. And we are also seeing some of the trauma that's happening to health practitioners and health workers who are seeing that many of these really surges that we're seeing, a third wave or a fourth wave, however we want to quantify that, could be avoided by very simple, just common sense initiatives. We do understand that there are some community members who may be concerned about vaccinations, but all we need to do is really look at the numbers and then see that the contagion rates are different, the hospitalization and the mortality rates are different, and then we can also look back and see how effective some of the social distancing mandates were, how different the outcomes were for communities that did embrace wearing masks and additional measures. So I think this is what we really have an opportunity to try to have a better go at it this time than last year.
One can only hope, right, that we'll do it right this time around. Tabitha, you wrote that policies such as lockdowns, which expose some populations to higher disease risk, they need to be better designed and implemented in future waves of the current pandemic and beyond. Tell us a little bit more about this.
You know, I think this is a really important aspect of this research, right? That we want to all achieve a better outcome in society. We all want an equal, prevention of COVID-19 for all of our community members, and that's important to all of us. So I do think that these lessons learned should be applied going forward. We're facing new variants of concern, and we as individuals can all benefit not only from helping essential workers and hoping that they're healthy and well and able to continue to drive the economy here in Utah while keeping us safe and well protected in our homes if we need to be there. But we also want to depend on these communities long into the future and have them feel secure and safe in times of crisis, just like the rest of us. So moving forward, we want to design these policies with the lessons we've learned about inequality, maybe taking into account aspects of structural inequality and trying to find ways to expand healthcare, for example, during times of crisis, or other safety nets that might particularly focus on these communities that are going out and exposing themselves, often voluntarily, to the crisis, to the COVID-19 pandemic, as part of being part of our community. So we want to do our best to incorporate and include those aspects and those individuals into policies that work well for everyone. And it serves us better in the long run as a community to avoid this problem in the future.
Daniel, we have to wrap soon, but let's get these questions in. What else do you think needs to be further researched to understand the impact of COVID-19 in low-income populations?
Well, one of the factors that we've been thinking about, which we did not have a chance to study yet, but we're pursuing, is the messaging that these community members receive. For example, here in Utah, the majority of the minority populations are Hispanics and Spanish-speaking groups, and we have done a similar study, a related study that looked at the messaging and how long was the delay to translate everything that was being found through the media, through the health departments into Spanish so it can be accessible. And it can't just be posted through traditional methods, but it has to be really taken to these communities so they can understand and really be on a fair and a similar footing as the English-speaking groups. What we really need to also focus on is accessibility to tests and accessibility to vaccinations. One of the really large problems at the beginning was that testing sites were not really equally distributed or distributed equitably so that all communities could access them. Again, when we discuss some of the essential workers, the blue-collar workers, many of them could not simply take off a couple of hours during the middle of their shift, for example, to go out and get tested or to go out and get vaccinated. Now, of course, things have changed. It's much more accessible to get vaccinated, to get tested. So that's really a good step forward. But we really need to understand that vulnerable community members, as I mentioned earlier, may be living in larger homes, may be forced to have to go to work. They just may not have a choice, and resources may not be as available to them as to higher income communities.
Tabitha, 30 seconds left. Final words. What's the takeaway message here? What would you like to leave our viewers with tonight?
You know, I really believe that our low income and our vulnerable populations here in Utah deserve, you know, the same sort of respect, right? They've gone out, they've kept us safe at home, and asking individuals to mask up and do our part to keep these individuals safe and healthy is the very least we can do for the essential workers who have worked in the hospitals and the grocery stores, have come to our homes and kept us safe. In addition to that, we of course want to support our communities, but this is also about solving COVID-19. We all have to do our part, and we can only do that if we work as a community and we care about each other in our community.
All right, you've been hearing from Dr. Daniel Mendoza, Assistant Professor for the Department of Atmospheric Sciences, and Dr. Tabitha Benny, Associate Professor for the Department of Political Science, both from the University of Utah. Thank you both for being here tonight. We appreciate your time and insight so much.
Thank you so much.
Thank you.
And don't forget, we'd love to hear from you about the show. We invite you to join our Facebook group by searching ABC4 In Focus, or send us an email, infocus@abc4.com.